I'm different from somebody else.
Yes.
You know, I have a number of friends that have had knee replacements, and some have gone well, and some haven't gone well.
Everyone's different. And first, thank you so much for taking the time to answer some of these questions. I mentioned that I did another interview with one of my other patients, but hearing your experience, like as a patient, compared to me as a PT, just telling other patients, oh, this is what you can expect. This is typically what it's like after knee surgery. It's just so valuable to hear from someone like you who's had not only one, but both knees replaced. Right? So just for like background, how long has it been since the most recent knee replacement?
6 months for my right knee.
Oh, 6 months, okay.
And 9 months for my left knee.
Oh yeah.
That's so very close together.
Yeah. I mean, some people, they'll take a year or so in between, but that's pretty close together. So your right one, 6 months ago. How are you in general 6 months later? So like today, specifically for the knee.
I'm doing great. Honestly, I was very lucky that I did a lot of research before getting my knee surgery, watching surgeries on YouTube.
That's brave. Not everyone does the watching the actual surgery.
Because I really picked robotics, and I knew I had a good surgeon. So I felt really, really good, and my outcome was probably the best that could happen to my knees. So now just a little bit of pain, and I think I expected that, so that wasn't something that bothered me. Just on the sides on both of them from time to time. But physical therapy is a lifesaver.
Helped a lot, right? And then so some people will ask, especially after months after the surgery. So you mentioned it a little bit where sometimes you'll have pain. What are some of the activities or movements that you notice you'll have a little bit of pain with when it comes to the knees? Yeah,
mostly it's sleeping. It's it's positioning my knees so that they are in an awkward position. So I always have a pillow between my knees, especially right up here. Making sure that they're comfortable so they don't touch, and that's something that's really important to me.
That's pretty good, because then most people after having knee surgery or before, if they're planning it, they'll expect to have knee pain with movement. So maybe like just bending down, doing like a little bit of a squat.
I don't.
Nothing there?
I don't have pain when I squat. I don't have pain when I'm walking.
Nice.
So those are the kinds of things that I haven't gone back to playing golf yet. So that's my ultimate goal, is back to playing golf. And I don't think that I'll have that much problem with them. I just came from a 6-month checkup on the right knee.
For the knee?
For both of them, actually. And he's just so pleased at how everything worked out for me. So
he said he said that you pretty much were recovering as expected and pretty well in terms of the knee. So let's say for your day-to-day, is there anything like with your knee specifically that you feel like you're limited by? I feel like you mentioned that your day-to-day, like your laundry and dishwashing, you can manage?
I think for me, basically still stepping. Stepping up and stepping down.
Oh, like stairs or anything
stairs.
Like that.
We have kind of an unusually long step out of our house.
Yes, correct.
It's like 9 inches, and that's a little bit taller than most. And that
challenge.
It doesn't frighten me, but I always have to make sure I hold on to something else as I step down. Step down on the bad one. Up on the knee. Step up on the good one.
Exactly.
So, yeah, that's the only thing, to be honest with you. And I think
that's pretty good.
Working on my balance and strength, it's such a key for me.
Well, it seems like you're doing pretty good so far for being 6 months out and 9 months out from both knee replacements in terms of at least being independent with your daily stuff, right? That's pretty good. A lot of people, they don't know what to expect. So 6 months out, that's typically what you'll see. So for the knee that you had first, so the left knee 9 months ago, would you say it was easier or harder than you expected in terms of the recovery?
It was easier in general. I think the first couple of days are tough.
Yes,
they're very painful, and don't think it's not going to be, because it is. And then as long as you take your drugs, you've got to take the meds. People who say, I don't want to get addicted. That's not true. if you take them the right way, you'll be fine.
You manage it.
Manage it, but you have to take the drugs. And after that, my knees were, this left knee was so bad, it was bent inward.
Yes.
And so the pain of that was far worse than the surgery was. So I was in heaven, to be honest with you, afterwards, because I knew that if I just keep doing the exercises and ice,
Yes.
and don't stop icing. Literally, I didn't stop icing for like five or 6 months on this one, maybe 5 months, and then this one about the same. You just keep, icing, and an ice machine really helps.
Yes, the ice machine's big.
Ice it's huge. It was huge for me, and because I literally didn't have much swelling.
Yeah.
And I didn't have much scar tissue.
That's pretty good. Yeah, you mentioned before that your movement was pretty good, not too much stiffness after the surgery.
Yeah, I had because I worked on the exercises twice a day.
Yes,
I worked on those. Worked on my exercises, and that allowed me to get to a 120 within 2 to 3 weeks.
Yeah, that's very fast.
And it just from then it just kept going. I mean, I kept getting better and better in terms of the range of motion.
Yes. Yeah. I mean, so you mentioned a few things, but in general, it being easier, than you expected. I think that's one of the big parts where it's like the pain is going to be different compared, like pre-surgery to post-surgery. It's a whole different level of pain. Obviously, the first 2 days, like you said, very painful. It's good to be on top of the pain medications that you're prescribed by the surgeon, just so you can manage that first couple of days, because you just had surgery. It is traumatic. It's a pretty invasive procedure.
Yeah.
But once you get past that, especially after you pass the first week, I mean, the pain, and you can share your experience, but it goes down dramatically after that first week. And as long as you're icing and taking the pain medications as kind of directed by the surgeon.
Well, I wouldn't say it's dramatic. I would say that it's probably it goes to a different level, a different level. But in 2 weeks, I still had pain.
Oh yeah,
I had still pain, and in the third week, and by the first month, I felt I was doing great.
Yeah.
Yeah, and you have to walk.
Yes.
You have to walk.
Yeah, even if you're having some of that discomfort, right?
Yes.
When you're standing, it's like you have to maybe don't go as far or go as long, but
right.
daily you still have to move, be on your feet a little bit, right?
And you said the medication, and don't get behind in it.
Yes, be ahead of it.
Because you're probably going to have oxycodone or hydrocodone, and either one of those, if you try to get off of it too soon, the pain comes, and then you go,
too late. You try and chase it.
Now you've got to
endure.
It's going to take a while. It's going to take a while. Yeah,
yes.
You're much more pain than you would have been before. So.
Exactly. Yeah. And I mean, you said it earlier, where it's like some people, they try to just avoid the pain medication at all costs, but then they'll suffer, and then eventually they're like, okay, I have to take it. But it's like now you're chasing the pain versus, if you were just using it as directed, you can continue exercising, you can continue walking, versus, all right, because I have so much pain, I'm going to stop, I'm not going to walk, I'm not going to exercise. So it makes it harder for you to
you got to be self-motivated. You really do. You got to be self-motivated. And one thing that I have to stress is that I'm different from somebody else.
Yes.
I have a number of friends that have had knee replacements. And some have gone well, and some haven't gone well.
Everyone's different.
And everybody has a different level of body type, where you might be the person that gets more scar tissue. And that has complications to it. You got to break them up. You got to break them up. Or you get so much swelling that that in itself is really painful.
Yes.
And so that elevation of your leg, along with the ice, is like super important. And sometimes I didn't do it as well as I should have, but
you can tell the difference when you did.
Yeah, I can tell the difference if I really let my leg go up, and my below, and my heart's below my leg up there.
Yes.
That really did help draw the swelling down. But I was really fortunate. I didn't have a whole lot.
Yeah.
It was good.
Yeah, I mean, that's one of the things where it's like, every body, like person to person, is going to respond slightly different to the surgery. Some just are great healers and recover like better than others, like both of your knees, and some they're gonna have more pain or doing certain movements maybe they're not as fluid as
Right.
you. But in general, there are like things that everyone should be able to focus on that will improve their recovery. So like the elevation and icing that you
Right.
mentioned, regardless if you're recovering well and your pain level is, let's just say 4 days after the surgery, they're like, oh, my pain is 1 out of 10. Well, you still should be icing and elevating the
Yes.
leg at that stage of the surgery, even though you're doing well. We want to keep doing well, right?
Yeah.
And especially if you're on the other side where maybe they're having 8 out of 10 pain, it's like, well, you definitely have to make sure you're icing and elevating
Yep.
and doing some of the exercise that you
Yep.
can, right?
And support in your team is really important.
Oh, yeah. That's
You
a
know,
big one.
like having, you're the right physical therapist, like, and you are the best. So I just want to say that. Having the right physical therapist, the right doctor,
Mm-hmm.
the right follow-up, the right support, like whether it's an app that you can use
Yes.
to follow or a workbook that sometimes they give you.
Like the packet from
a
discharge
packet with all
exercise.
I mean, read it. It's boring, but read it.
It helps.
Follow that. And if you have an opportunity to go to the, some of them have a pre-surgery meeting.
Yes.
Where you can go and learn about the operation, what it takes, and what kind of support they have afterwards.
Yeah, for
that was
recovery.
really helpful. You bring your partner, or your
Yeah.
husband, your wife, whatever it might be, with you, so that you have all these folks that are working together to help you
Yeah.
get better. And then you do your thing, and you should get through this really, really easily.
Yeah, and that's one of the things that I found with some of my other videos where, people from different parts of the country or different countries, they may not have the access to different follow-up care
Yes.
or physical therapy, and they're doing a lot of this on their own, and they'll kind of like, I've seen where they said that, oh, I don't have any physical therapy after 2 weeks after my knee replacement. And I'm like, ooh, that's why for me, I try to make some of these videos where from your experience, you see how important and helpful it is to
Right.
have physical therapy like as soon as possible.
Yep.
And having like that care team like throughout you for your whole recovery,
Right.
before, during, and after surgery,
Right.
because that's when you're gonna have the best results in terms of the outcome. But for the individuals who don't have it, it's like recovery will be tough.
Oh, it's tough.
So that's why it's like the more
Because
resources you have.
it really impacts the way your body moves afterwards. And I had a physical therapist that came the day after I got out of surgery.
It's fast, very
Yeah,
fast.
that's a home health care, and they're with you for 3 weeks. And I happen to have a really good one, and she really helped me get through what I needed to. And there's sometimes, honestly, that you don't have the energy, or you don't
Yeah.
have anything that day.
That'll happen.
Like you are drained completely that day. And having somebody good who understands that and really works with you and doesn't like ignore you or chastise you or whatever, that's really helpful, because we're only human beings. We come every day with what we've got.
Yes.
Sometimes it's more, and sometimes
It's
it can be
less.
really less.
Yeah.
You could have like 10% energy, and you just have to tell them that, look, I'm here today.
Yeah.
I'm like way down here, or today I've got it. I'm ready to go.
Yeah.
So
Yeah, it makes such a difference having that support. And I mean, even like going on that kind of that trail of thinking, it's like on your days when you're not doing so well, whether that's fatigue, energy wise, or you're just having a lot of pain, or you just don't have the motivation, like especially the first 4 weeks, 0 to 4 weeks after
Right.
surgery, it's like, well, there's still things that we can work on, even if you're on a low end of energy or
Yep.
you have a lot of pain. There's
Yep.
other things that will help you versus taking a whole day off just
Yeah.
to let just to get yourself
Yep,
together.
exactly.
It's like there's some kind of improvement we can make every single day.
Exactly.
So it's like having that, the expertise, someone to help you like
Yep.
find this is doable and this will benefit you, even on those tough days.
it's so true. And I was just thinking too, is that what I found helpful for myself, and some people are not like this. I'm analytical, so I like to keep
Yes.
track of stuff. I like to keep track of numbers. But I kind of made a diary for myself every day.
That's very helpful.
Got up at this time, ate at this time, walked at this time, iced at this time, napped, at
It's
this
systematic.
time,
It's good.
and it just kind of gives you no, and also when I took the drugs,
that's very
keeping
helpful.
track of
The
when you take
administration,
the drugs, and
yeah.
especially if you don't have somebody, who's helping you administer drugs,
Yes,
because a lot of
yes.
us don't. But keeping track of, okay, I took my or my hydrocodone then. I took it there. So that, hey, I'm not ready for another one yet. So that helpful. And I realized that your first few days, you're not hungry. You eat like a half or a quarter. I remember having a half a sandwich, and I said, cut it in fourths, and I'd eat a fourth.
Yeah.
Because you're dealing with the anesthesia coming out of your body.
Your body's changing a little bit, a lot of recovering.
Your stomach's not feeling all that great, and you just have to take it easy.
Yes.
But manage to eat, though. Try to eat.
Because your body needs that fuel to recover.
Yeah, especially the protein, because your bones are kind of having to recover. And
a lot of tissue healing that needs that extra protein to rebuild and repair is super important.
Yep.
Definitely. Yep. So, you've had both knees replaced. Would you recommend, a knee replacement to people who are having knee pain and they've done physical therapy and they're considering it or having questions about it? Like you personally, from your experience, would you say you recommend it, you don't recommend it?
I absolutely do if you need it.
If you need it. Yes.
Yeah, if you need it. And your body will tell you if you need it. I mean, I couldn't walk on my legs anymore.
See, I was going to ask you, how did you know?
Yeah, the left knee was always my worst, and then my right knee was pretty good. But over the last few years, because I was putting so much strain on this knee went bad too.
Yeah, you're compensating.
You're compensating. So if you have to get it done sooner rather than later. They won't recommend it in your 40s, but 50s, 60s.
Yes, that's when
70s.
Typically.
Yeah, absolutely. Get it done. And, I did robotic, but it was my choice. I really wanted to have a robotic surgery after I looked at all the
research,
the options and it just left no guessing for the surgeon. They know exactly what to do, and it's not as invasive. And I thought I healed
very
better.
well.
Yeah, I healed very well. Yeah.
So for you, you can pick either knee. How much sooner, if you had to say, you would have had the knee replacement if you known your recovery and your outcome was going to be essentially this successful? Would it have been you would have had it 5 years ago? What do you think?
I would have had it 10 years ago.
10 years ago.
Yeah, 10
Kinda
years
what you're
ago.
saying.
And I think, the mindset for me was, I don't want to take off time from work. No,
Yes, that's massive.
They'll replace me. No, and that's just bull. It doesn't. People don't do that. If you're working for a good company, they're gonna
take care.
They're gonna work. But there was a 3-month, and I went back after 10 weeks, and it was too soon. I felt it was too soon. I wasn't. And because I had a back surgery before that, so
yes, correct.
I wasn't healed enough, and I think that just it depends on your job.
Yes. How
if you can, don't worry about it. They'll hey, you'll get back to work.
Yeah.
But I would say do it as soon as you can, because it just wears the rest of your body out.
Yeah.
These knees also affect my hips.
Yes.
My hips affect my back. Well, it's just it all works together.
Yes, so. That's exactly right.
Yeah.
And I think we touched on this a little bit, but kind of looking back at all your recoveries for both knees, what do you think helped you the most? If you had one or two things that you would say, doing this helped the most, or resting, or anything like that.
Exercise, walking. I felt that gave me the foundation of strength. Because anytime you have any kind of surgery, it really zaps your body in a lot of ways, and meaning that you don't have the strength you got to rebuild it back up. No matter what, you got to start again, and you got to rebuild your strength. And I think had I not done that and done the exercises to get range of motion, I think I would have had a lot more scar tissue.
Yes.
And I think that it's just you have to do it. Don't put it off. You got to do it. Set a timer. Put it on your calendar. You got to do it.
Yes, exactly. And that's, obviously one of the things that when I go over with patients who just had a knee replacement, I try to set the expectation of, certain exercises might feel fine, but when we're talking about a lot of the range of motion, so whether we're trying to like do some heel slides, bending the knee, like some of these exercises won't feel great. Your goal is to just work in that range where it's tolerable, right? You're not trying to like kill yourself and put yourself in so much pain, but we do have to get it moving. So expect some discomfort. So is that kind of like what your experience was, right?
Yeah, and and don't push yourself to pain.
Yes.
Don't do that. I mean, that's really important. That's why exercise, and I think that's why people, they might get someone who pushes them too hard or strains them too hard, and it's just unbearable. Don't let anybody do that to you. I had to stop one physical therapist from doing that to me, and you have to speak up. You have to say no. If it's pain, really painful, don't do that. Do it to right up to where it's almost painful, and then
you can where you can tolerate it.
Yes, where you can tolerate, because you can push yourself a little bit more. But once you go to the pain part, your brain goes, I don't want to do that anymore. And you will say, no, I can't do it. I can't do it.
Yeah.
And that's not a good thing.
Yeah. And then that'll stop people from doing their homework. They'll say, I'll see them in the next visit. And if they did that, they're like, oh, I haven't done that exercise since this one time because when I tried it, I had a lot of pain. Well, it's like you kind of overdid it. You went too far.
Yes.
And like we talked about this a little bit earlier, but it's every body, like physical body is going to be different. So even though we have our numbers, our range of motion, like the degrees that we want to hit at certain timelines, it's like just because you're not there or you're at a different number, that doesn't mean you have to push yourself to hit a specific number because it's that time. It's like, well, if your body is telling us you're at a 8 out of 10 when we're bending it to a certain, position, it's like, that's too much, You'll get there, but you have to really like listen to your body.
Yeah. And I think I was really fortunate to have somebody right off the bat. And I had this home physical therapist twice.
Yes.
Because I asked for her again. And I was so happy that, she said, don't go to pain, And I think that's the biggest thing, that people stop doing anything.
Yeah.
Because they just don't want to, and it's just human nature. We don't want, we avoid pain.
Yeah, well, that's why they had the surgery, right? They're like, I had knee pain before, and then I had the surgery. I don't want to have more knee pain, so I'm not going to push myself.
Yeah, exactly.
Yeah, it's like really understanding your body.
Yep.
So far, you're giving like super good like insight and experience. My last question is for individuals or patients who are possibly looking into having like this, the knee replacement, this procedure. If you had to pick like 3 tips or 3 specific things that you would share with possible patients that you should do these 3 things that will help you the most, what would you share?
Well, I think I've said them, but
just like reiterate.
I'll say them again. It's ice.
Yeah.
Elevation and moving.
Yes.
You gotta move. You gotta do your exercises. You gotta walk, and even a little bit. Like you and I have. There are times where I've gone out and I've walked just very minimal, and I just said, I don't have any more energy today. It's done. But then there's times where I go out and I push myself a little bit further, and I think those are the 3 things. You've gotta ice.
Yes.
And don't be afraid to, if you get one of those ice machines, which I really, really recommend. They're not expensive. You can get them on Amazon or get a used one or anything like that. But having that wrapped around your leg, and you can leave it on for hours. Leave it on for hours, because that knee the swelling has to go down, and the knee has to be able to regenerate itself, and it doesn't do that if it has swelling.
So much swelling. Yes, very true.
Yeah.
So I know we talked about those 3 tips throughout the kind of like all of our questions.
Yep.
But I think it's because they're so important in your recovery in terms of reducing your symptoms, bringing down the swelling. But even with your exercise, with your walking, if you have so much swelling and you're not elevating the leg, it's like, well, now you can't walk as well. So I think those are super helpful.
It's stiff.
Yes, you get very stiff.
It's stiff. It gets stiff. And just recently, I think it's gotten to the point where I don't have any stiffness. So, yeah, I don't have any stiffness. And I think after a year or so, I won't have any of the side pain, from sleeping wrong, So,
yeah, I mean, you're still not even at a year. You're at 6 months and 9 months, so technically the body's still recovering to an extent. So yeah, you're doing pretty good. Well, thank you so much for answering those questions. I mean, very helpful advice.
I love you, man, and I thank you so much because this is fun. This is fun to share whatever I can to anybody else.
Yeah, definitely helpful. Well, thank you so much.
Thank you.